I'm Diane Leekso with Team Schleit Foundation, here with Beth Holland, who's a physical therapist, for another personal journey. We are trying to add to our website journeys from warriors, clinicians, and caregivers. So we're here to hear from Beth and her experiences working with glioblastoma patients. So tell us about what you do working with glioblastoma patients.
I am a physical therapist. I have been a physical therapist for 21 years, and I have worked in multiple different areas of practice. I have worked in outpatient neurophysical therapy, neurorehabilitation. I have worked in inpatient rehabilitation. I did a few years in acute care hospitalization with individuals with many oncology diagnoses. And now my primary practice is back in inpatient rehabilitation. I have my physical therapist, neurologic certified specialist designation, which I've had since 2007.
So how did you become interested in working with this population? Oncology patients, brain tumor patients?
Oncology patients, I have personal history and family history with oncology diagnoses. So that's one of the reasons I sought out physical therapy and healthcare and in general. And I think I had my first patient with glioblastoma maybe 3 weeks into my first job. It was a pretty quick transition from student to real world practitioner. And I still remember that person, and I still remember many of the people that I've worked with glioblastoma. And through a thread that has run through all of the years has been working with individuals with oncology diagnoses, coupled with my neurologic specialty, means that I just happen to see more people with injuries affecting their central nervous system than any other diagnosis currently.
Can you tell us about some of the impairments that you work on with brain tumor patients?
I like to say, if it matters to you, it matters to me when we talk about impairments for people with brain tumors. And so sometimes the basic physical therapy type things, so strengthening and stretching and balance and coordination work, those are what comes to mind when you think of physical therapy. But it can also be walking or dancing or bowling or golf or any other gardening. Gardening's a big one. We're doing this interview in May, so gardening is a big one in the moment right now. Anything that is important to the person who is sitting in front of me at the moment is going to be a thing we could work on in physical therapy. I can find a way to make your hobby or your life skill into a physical therapy skill also.
So when a newly diagnosed glioblastoma patient is going to receive physical therapy services, what can they expect at that first session?
Well, that's a great question. In an initial examination, it does not actually matter if it is in inpatient rehabilitation or outpatient setting or even in home health, the physical therapist will do an examination, which will start with an interview to identify what are your goals? What are you having challenges with at home? I can't just decide that something's worth it to work on. You have to tell me what's important for you to work on. Or you and your family decide together, or you and your caregiver decide together what are the things that you might want to work on in physical therapy. Then we do check your vitals and check your pain and screen your strength and your range of motion, how well your joints are moving, and maybe sensation and coordination. And then we go to balance testing. For a person who's mainly sitting, we'll do all of the sitting balance tests. For people who are also standing and walking, we'll do standing balance or walking balance. We might do stairs. We might do walking outside. So all of the things that are part of the physical therapy examination usually lasts 30 to 45 minutes. I make it sound like could be hours. All of this usually lasts about 30 to 45 minutes, and we could get a read on what is important to this person to work on and how can we make an impact in their movement.
Is there anything special that they should do to prepare for that first session?
Wear workout clothes, which in current years post-pandemic. Everyone's wearing workout clothes most of the place, but workout clothes, good shoes. And if you can, get rest the day before or the night before. Don't come after you've done the whole day of appointments and make this the last appointment of the day, because usually physical therapy will be testing how you're moving and testing the physical function. So, but other than that, come with an open mind and come with some ideas about what you want to work on.
Are caregivers included in your treatment sessions?
Caregivers are definitely included in our treatment sessions. The person who lives with the brain tumor, or the person that lives with the glioblastoma, is the person who it is directly impacting. But a brain tumor affects all of the people in their circle and all of the people who are being part of the support team, or even just part of the ancillary team driving people to and from things. This affects everyone who comes in to interact with a person who has a brain tumor. So our primary focus is the person's need for mobility work or rehabilitation, but the caregiver, we need to talk about, they sometimes have great ideas for goals, or they have ideas and insights about what's safe at home and how things have been going at home. And we can talk about their body mechanics when they're helping, or is there a piece of equipment that we could bring in that would maybe make your life easier? Or are there ways that you can pace yourself? Or are there ways that we can do this activity safer for anyone or better for anyone, or just help to prioritize? Because the days of being a caregiver are sometimes very, very long and always also very short. And so you just don't have enough time for the things that you want. So sometimes that's all we do, is prioritize. What's the most important thing, or what's the top 3 things that you would do for mobility to help today? And you can leave these other 17 things off the list, and we'll get to them when it's time.
How do physical therapy services change over time as a patient moves from initial diagnosis and resection through the different stages of treatment?
That's a great question that I think really depends on where the physical therapist and the person with a brain tumor are first meeting each other. If it's in the acute care hospital, well, then the thing that people are trying to do is get out of the acute care hospital as quickly or as safely as possible. So those goals are really set on, what do I need to do to leave here? Please let me leave here. And then sometimes the goals are, if your person is in inpatient rehabilitation at a rehabilitation facility, it would be working toward what's going to make you safest at home, or what's going to make you most independent at home, or what's going to make it so that you can do the things you really want to do at home, and again, be out of the facility and somewhere else. For individuals who are either doing outpatient care or home health, it's what do you want to be able to do? And for some people, it's going on walks outside. For other people, it's gardening. For other people, it's being able to sit up to watch the game with their family when they come on Thursday afternoon. So all of these things really depend on, one, where we're seeing each other for the first time, where the goals are, and then what's important to the person in front of me at that moment. And there's always a mix of a lot of emotions, and cycling through all of those emotions in like a 3-minute period is also pretty common. And so what somebody gives us as a thing we're going to work on today might be different than we work on tomorrow. And there's nothing wrong with that. In fact, sometimes that's where we need to go. So I try to think of my role as a coach or a guide or a person who's read a lot of literature, a lot of research, but I'm not the person living in the body that is working. So I'm more of this person giving options and laying things out of what we could do and what physical therapy can do to help, and then what might need to be worked on when I'm not around, or what isn't something that physical therapy can help with too.
Tell us about the collaboration that occurs with other team members, like the neuro-oncologist, the neurosurgeon, occupational therapist, speech-language pathologist, social workers, things like that.
I think the more healthcare workers involved, the better in rehabilitation. It feels like there are so many clinicians. There's so many doctors and so many second opinions, and also so many people telling you what you should do or what you're required to do. What's your next step? People giving you this. And I think when we come to rehabilitation, we're kind of working on what we're allowing the person to make some more of their own choices. And it's more of a, what do you think we need to work on? Well, if it's something related to occupational therapy and it's maybe fine motor, then I'm talking with the occupational therapist on the team that I work with. If it's something regarding memory or swallowing, I'm talking to the speech pathologist. If it's regarding when is the next treatment, we have to schedule this many sessions. When is your next treatment scheduled for? Or do you have treatment all week this week? Should we schedule it for after that? These are conversations that we're having with nurse navigators and social workers. And we're reading all of the notes that the medical team is putting in, and we're calling them and we're talking to them. In the inpatient rehabilitation setting that I work in, we have daily interdisciplinary rounds where we have nursing and physicians and physical therapy, occupational therapy, and speech therapy, and a care manager, all talking about what's needed for this person today and what's going to be needed for this person this week. We keep bringing this person up each time we talk to make sure they're getting what they need. So it's like a little web of lots of care.
As you reflect on your work with glioblastoma patients, what stands out for you?
I knew you were going to ask this question, and this was probably my favorite of your questions. I love them all, but what stands out for me is that I just feel so lucky to get to be part of this life. That whatever this person is dealing with, and it's a big life adjustment, a big life change for them, for their family and their loved ones, and there are a lot of feelings around it, that I get to come in and be a helper person. That's what I love. And I get to not tell the person what to do, but ask them, what should we do? And ask them about their goals. And I think it's a complicated time of life to be diagnosed with and go through treatment and go through life with a brain tumor. And I just feel really lucky that I get to help and be there and witness the really human parts of life while we're doing our work.
If someone sees you who is newly diagnosed with glioblastoma, what would you like them to know?
Oh, so many things, but the biggest one is that you are definitely not alone. And there are so many people who want to help and actually can help. And it's almost overwhelming, I imagine, sometimes, that you don't know what to ask for, or you're not sure how to ask for help. And knowing that rehabilitation professionals, our job is to know how to help. Like it's a clear role, and we're here to make movement easier and make movement safer. And there is a really cool piece about having those independent decisions and getting to make the choices that you want while also going through all of this.
Well, I think I can say that all of your patients are lucky they get to work with you.
Thank you.
Thank you so much for sharing your experiences with us today.
Thanks for inviting me.